America, 1937. The Great Depression still gnawed at kitchen tables across the country. Doctors' offices were crowded, hospitals stretched thin, and families clung to the smallest glimmers of medical hope. Anything that promised relief from pain or fever or infection. That year, in the southern states especially, a new miracle medicine began to spread through pharmacies. Small glass bottles with neat white labels and a cheerful claim. Elixir sulfanilamide, raspberry flavor. It was bright, sweet-smelling, and pleasant on the tongue. Mothers stirred it into water for their children. Pharmacists praised its smoothness. And the company behind it, S.E. Massengill, advertised it as the next evolution in modern healing. To a country desperate for affordable medicine, it was irresistible. To the people who took it, it would become a sentence of death. Sulfanilamide itself was not new. It was one of the early wonder drugs, part of the first generation of antibiotics before penicillin became a household name. It could cure streptococcal infections, illnesses that once meant slow, painful death. But there was one problem. Sulfanilamide came only in powder or tablet form. For children or those who couldn't swallow pills, the treatment was useless. So the Massengill chemists were told to find a way to turn it into a liquid. Something pleasant, something drinkable, something that would sell. In an era before pharmaceutical regulation had teeth, there was no law requiring safety testing of new drug formulations. A company could change ingredients, mix in solvents, add color or flavoring, and put it straight on shelves. The assumption was simple and deadly. If it worked before, it'll work now. The chief chemist, Harold Watkins, searched for a solvent that could dissolve sulfanilamide completely. After several failed attempts, he found one that blended beautifully. Diethylene glycol, a syrupy liquid that made the mixture smooth and sweet. What Watkins didn't know, what few outside of industrial labs understood, was that diethylene glycol was a close chemical cousin to antifreeze. It was a poison, tasteless, colorless, and deadly in even small amounts. The mixture shimmered pink. Raspberry flavoring covered the scent. Labels were printed. Orders shipped. By early autumn, the bottles began to reach customers from Tennessee to Oklahoma. The first deaths came quietly. A mother in Tulsa brought the elixir home for her 6-year-old daughter, who was fighting a throat infection. The syrup went down easily. Within a day, the girl began vomiting. Her breath turned shallow. She lost control of her limbs. The local doctor, baffled, suspected meningitis. She was gone within 72 hours. Elsewhere, a grandfather took it for a chest infection. He complained of stomach pain, blurred vision, and confusion. In another town, a pharmacist's wife, proud to test her husband's newest stock, grew gravely ill overnight. Doctors noticed the same strange pattern. Patients who had been expected to recover suddenly fell into agony. Vomiting, convulsions, kidney failure. Some died clutching their sides, delirious, begging for water. Within 2 weeks, physicians in different states began writing to each other, comparing notes. The symptoms were too similar to be coincidence. Yet all the patients had been treated with different antibiotics. Or so it seemed. When the Food and Drug Administration, still a small, underpowered agency in those days, received the first telegrams, investigators were dispatched. At first, they assumed contamination, perhaps a tainted batch or bacteria introduced during bottling. But as reports spread, one name kept appearing: elixir sulfanilamide. The FDA's field agents began an urgent manhunt. In 1937, the FDA had no authority to recall a drug, only to request cooperation. Every bottle of Massengill's elixir had to be traced and recovered manually. There were no barcodes, no databases, no instant communication. Agents traveled by train and car, visiting pharmacy after pharmacy, store after store, pleading with clerks to pull the bottles. It was a race against death. In some towns, the agents arrived too late. Families described sudden illnesses, unexplained fevers, deaths that made no medical sense. Little wooden coffins lined the autumn cemeteries. By the end of October, the link was undeniable. Every victim had taken the raspberry-flavored elixir. Every bottle contained diethylene glycol. The solvent that dissolved sulfanilamide had also dissolved their lives. Newspaper headlines began to stir. Drug kills dozens across South. Elixir blamed for mysterious deaths. Inside the Massengill offices, executives at first dismissed the reports. They argued that sulfanilamide had long been proven safe and that no one could prove the solvent was the cause. But when the FDA's chemical analysis confirmed it, when autopsies revealed massive kidney destruction consistent with glycol poisoning, there was no denying it. Harold Watkins, the chemist who had created the mixture, was devastated. He had tested for taste, color, and clarity, not for safety. There was no requirement to. No precedent. He had done what every other chemist did at the time. But in his beaker, ignorance had become lethal. On November 22, 1937, unable to bear the weight of his mistake, Watkins took his own life. By then, more than 100 people, many of them children, were dead. The tragedy shocked the nation. The public had trusted medicine. Doctors had trusted the label. And the government had trusted that companies would act in good faith. Now, trust was broken. For the first time, Americans began to ask, who makes sure our medicine is safe? As the investigations unfolded, one truth became clear. There had never been a law requiring a company to test a drug before selling it. Until now. By winter, the name elixir sulfanilamide had become infamous. Newspapers called it the poison cure. But in small towns across the American South, not every bottle had been found. Federal agents, working without modern records, traced shipments through crumpled invoices and handwritten ledgers. They boarded trains to rural towns where mail-order pharmacists worked from back rooms. They followed paper trails into dry goods stores that sold medicine beside tobacco and soap. In many cases, they arrived just hours too late. A bottle already opened, a child already sick, a funeral already arranged. In Arkansas, one agent named A.J. Hoover recalled walking into a home where the parents had lost 2 children in the same week. He opened the family's medicine cabinet and found a half-empty bottle with the words raspberry flavoring stamped neatly across the label. The cork was still sticky. The mother sat silently on the edge of the bed, clutching a small doll, refusing to look at him. It wasn't a crime scene in the traditional sense. There was no killer to arrest, no weapon to seize. Only a bottle, sold legally, produced professionally, and distributed nationwide. And that was what made the horrors so unsettling. This wasn't a back-alley tonic. It came from a trusted pharmaceutical manufacturer. Doctors had prescribed it. Pharmacists had stocked it. Even government bulletins had listed Massengill as a reputable firm. If they could sell death, who could be trusted? The FDA, at the time, had fewer than 300 employees. There were no field offices in every state, no emergency recall powers, no system to issue warnings to the public. So investigators relied on word of mouth, telegrams, and local radio alerts. Return all bottles of elixir sulfanilamide immediately, they announced. Do not consume. Dangerous product. But radios were luxuries, and some rural families didn't own one. Even when they heard the warning, not everyone believed it. The syrup had worked fine for them, or so they thought. Some had taken small doses. Some had already finished their treatment without immediate reaction. They refused to hand it over. In one case, a shopkeeper argued with federal officers for nearly an hour, insisting that Washington men had no right to confiscate his property. He finally surrendered the stock when the agent poured one bottle onto the ground and told him, quietly, if a dog drinks that, it won't live till morning. That was the level of proof it took. Back in Washington, public outrage boiled. Congressmen received letters by the hundreds, parents demanding accountability, doctors describing helplessness, nurses recounting nights spent watching children slip into comas. Journalists compared the event to a silent epidemic. No germs, no contagion, just a poison wearing a pharmacist's smile. The Massengill Company, facing lawsuits and condemnation, released a statement that only worsened their image. "We are deeply sorry," their president wrote, "but we do not feel that we have been negligent. We did not know diethylene glycol was dangerous." To grieving families, it sounded like a mockery. Ignorance now was their defense. But technically, it was true. There was no law at the time requiring companies to investigate the toxicity of inactive ingredients, the solvents, dyes, or flavorings mixed into drugs. If a medicine contained a proven therapeutic substance, it could be sold freely. Sulfanilamide itself was safe. The solvent was not. And legally, that didn't matter. The FDA's chief investigator, Dr. Walter Campbell, testified that his team had identified the cause within days but could only act through persuasion. They could not confiscate products without consent. They could not fine or arrest executives. They had to ask for cooperation, even as death tolls climbed. For every recovered bottle, another slipped through. By December, the final count stood at over 100 confirmed deaths, 34 of them children. And experts suspected the true number was higher. In one Arkansas town, a doctor kept a personal notebook. He treated 9 victims. 6 had died. He wrote in the margins, "They begged for water, but could not swallow. They screamed from the pain in their backs. Their eyes turned glassy, and then they went still." It was kidney failure, the same silent signature seen in every autopsy. Diethylene glycol built up in the blood, destroying tissues, shutting down the organs one by one. There was no antidote. The poison worked slowly, giving families false hope. Patients would seem to recover, then crash without warning. It was this cruel rhythm, the rise, the fall, the waiting, that haunted physicians most. Many of those doctors would later testify before Congress, urging reform. Some wept on the stand. The Massengill case became a mirror reflecting every blind spot in American drug law. For decades, the Pure Food and Drug Act of 1906 had served as the only safeguard, and even that focused mostly on truthful labeling, not safety. It punished misbranding, not toxicity. So when elixir sulfanilamide began killing people, it was technically legal from start to finish. A medicine could be pure, it could be properly labeled, and it could still kill you. In the aftermath, the FDA organized a massive public appeal. They printed flyers urging consumers to check their medicine cabinets. They sent photographs of the bottle to newspapers nationwide. Some families mailed back unopened bottles with trembling letters attached. One read simply, "We saw what it did to our neighbor's boy. Please take it away." Another note came from a pharmacist who had refused to sell the batch after noticing its unusually sweet smell. His hunch had saved lives. But his story raised a chilling question. Why had safety come down to luck? By Christmas, most of the known bottles had been retrieved. Yet the grief lingered. Across small towns and cities alike, fresh headstones marked the lives lost to a medicine that promised healing. In some communities, doctors began warning patients to distrust new drugs entirely. Pharmacists hesitated before stocking unfamiliar brands. Trust, once broken, was not easily rebuilt. And behind the walls of the Capitol, legislators began drafting something unprecedented, a federal law that would give the FDA real power. It would take the blood of innocents to forge it. In laboratories lit by cold fluorescent lamps, federal chemists began the grim task of reconstructing the poison. They wanted to know exactly how a clear, harmless-looking syrup had turned into one of the deadliest modern medicines ever sold. On the long steel counters lay small, corked bottles of elixir sulfanilamide, recovered from pharmacies, homes, and hospital wards. Each was labeled with confidence. Raspberry flavor, safe and effective. And yet inside, the solution shimmered faintly like antifreeze in winter light. One drop was enough to kill a cat. A teaspoon could destroy a human kidney. The chemist traced every step back to its source. Massengill's internal notes revealed a single directive. Find solvent. Must dissolve sulfanilamide completely. No toxicology tests were mentioned. No references consulted. The chosen ingredient, diethylene glycol, DG, had been used before, but only in industrial products. Brake fluid, paint removers, and engine coolants. In 1937, its human toxicity was largely undocumented in American medical literature. Yet anyone working in chemical manufacturing knew it wasn't meant for ingestion. Some foreign journals, German and French, had already reported renal failure in animals exposed to DEG. But the studies were obscure, untranslated, buried behind academic walls few company chemists ever scaled. Inside the FDA's lab, Dr. James Goddard, one of the agency's younger scientists, began animal trials to replicate the symptoms. They administered minute doses to rats. Within days, the rodents became lethargic, stopped eating, and trembled before collapsing. Postmortems showed the same crystalline damage to kidney tubules found in human victims. The discovery confirmed their worst fear. This was not contamination. It wasn't a bad batch. It was chemistry itself. The very solvent chosen to make the medicine sweet had converted it into a slow-acting toxin. The science was brutally simple. Once swallowed, diethylene glycol breaks down into acidic metabolites, compounds that strip the kidneys of their ability to filter blood. As these toxins accumulate, the body's chemistry collapses, the blood turns acidic, pressure plummets, the brain fogs, and finally, organs fail one by one. It is a quiet death, almost polite in its onset. Patients appear drowsy, then delirious, then still. Massengill's chemist, Harold Watkins, had not known. When questioned by FDA agents before his death, he admitted that he'd tested the mixture for taste and color only. In those days, that was common practice. If it looked pure and smelled pleasant, it was considered safe. After news of the fatalities reached him, witnesses said Watkins locked himself in his lab for 2 days. He emerged pale, trembling, and silent. A week later, he was found in his home, gone by his own hand. The suicide struck the public with conflicting emotions. Some saw him as a tragic fool, others as a scapegoat crushed by a system that rewarded speed over scrutiny. But the truth was colder. One man's ignorance had met one nation's inaction. Inside Congress, the hearings began. Families arrived, clutching photographs, small portraits of children smiling beside Christmas trees that would never again be lit. Doctors recounted how their patients had died despite every effort. And at the center of it all sat Massengill executives, stone-faced behind polished tables. Senator Royal Copeland, himself a physician, asked a question that hung like a blade in the air. Did you, at any point, test this preparation on a living creature before offering it to the public? The company representative answered, "No, sir. There was no requirement." That single sentence would echo through history. The forensic analysis laid bare a sequence of decisions so ordinary they could happen anywhere. A company chemist searching for an elegant solvent, a supervisor insisting on a marketable flavor, a production team dutifully bottling, labeling, and shipping, a pharmacist stocking shelves, a doctor writing a prescription, and finally, a mother measuring a spoonful with trust in her heart. At no stage did the law intervene. Not once did regulation ask, "Has anyone proved this won't kill?" By March 1938, the FDA had compiled a comprehensive report, 107 confirmed deaths, including 34 children, 71 adults, and 2 infants given doses by well-meaning nurses. Each death was preventable. The findings detailed every technical failure. There had been no toxicity testing for the inactive ingredients, no meaningful manufacturing oversight beyond ensuring that labels were truthful, and no authority whatsoever for pre-market review or the seizure of dangerous products before they reach consumers. The conclusion was chillingly bureaucratic. All actions taken by the manufacturer were in compliance with existing law. In compliance, and yet over 100 graves. As journalists published the chemical diagrams, public trust crumbled further. Americans saw the curved molecular structure of DG printed beside headlines like "poison in the medicine cabinet." For the first time, chemistry itself seemed menacing. The age of blind faith in science had ended. The age of regulated science was about to begin. Across editorial pages, writers demanded a law with teeth. One columnist asked, If a chemist must test his paint, why not his potion? Meanwhile, Massengill attempted damage control. They recalled their remaining stock, issued condolences, and paid settlements. But civil suits could not fill the void. Under Tennessee law, wrongful death damages were capped at a few $1,000s, a fraction of a life's worth. Still, the case bankrupted reputations. Doctors boycotted the firm. Pharmacists whispered its name like a curse. And behind closed doors in Washington, a small group of reformers drafted what would become the Food, Drug, and Cosmetic Act of 1938. They vowed that never again would a company need permission to sell safety itself. Yet even as the legal machinery turned, families continued to send letters to the FDA. Some asked whether their loved ones' bodies might be used for study, hoping their loss could protect others. Others wrote simply to thank the agents who had knocked on their doors, rescuing unopened bottles from shelves. Those letters became part of the agency's archives, a testament to grief turned into governance. In the final analysis, scientists presented a haunting chart. Each bar a life, each column a day since the first shipment. The curve rose sharply, then flattened after the recall. Proof that knowledge, once shared, could halt catastrophe, but could not erase it. From a single solvent sweetness, the world had tasted the cost of assumption. And out of that bitterness, a new doctrine was crystallizing. No drug shall enter a human body until science proves it safe. In the months that followed, the public outcry refused to fade. Newspapers kept the story alive, publishing the faces of children who had died after taking the raspberry flavor elixir. Editorials spoke with fury and disbelief, not only at the company's negligence, but at the hollow laws that had allowed it. Families asked the question that lingered in every home: how could this have been legal? For the first time, ordinary citizens began to see the cracks in the nation's drug system. The old Pure Food and Drug Act of 1906, once hailed as a triumph, suddenly looked like an antique, a law built for an era of mislabeled tonics and snake oil hucksters, not for the chemical age. In Washington, reformers inside the FDA, still reeling from the tragedy, began working with lawmakers to draft a bill that could finally give them the power they'd always lacked. It was an easy fight. Powerful pharmaceutical lobbyists argued that stricter laws would strangle innovation, drive up costs, and drown small companies in paperwork. But against the backdrop of fresh graves and national mourning, their words sounded hollow. Senators read aloud the names of victims. Parents testified about their final moments. Doctors described the helplessness of watching patients die from a medicine meant to heal them. In hearing rooms thick with cigarette smoke and sorrow, it became clear that this was no ordinary legislative debate. It was a reckoning. The draft bill called for one radical change. No drug could be sold in the United States unless the manufacturer first proved it was safe. That simple sentence would reshape modern medicine. For the first time, the burden of proof shifted, not on the government to catch harm after it happened, but on companies to prevent it before a single bottle left the factory. It also granted the FDA authority to inspect plants, demand testing data, and seize dangerous products before they reach consumers. These were powers the agency had begged for since its founding, denied again and again, until blood forced Congress to listen. But not everyone wanted reform. Behind closed doors, industry executives warned that too much regulation would cripple progress. They painted visions of bureaucrats delaying life-saving drugs, of endless red tape choking the miracle cures of tomorrow. In those smoky backrooms, the argument was clear: a little risk was the price of innovation. Yet in 1938, America had just seen what that risk could cost: the lives of 100 innocent people, many of them children. And in that moral contrast, the decision became inescapable. President Franklin D. Roosevelt, already burdened by the Depression and the looming threat of war in Europe, took a personal interest in the bill. He had read the headlines, seen the letters, heard the cries of families who had lost everything to a spoonful of trust. When the legislation finally reached his desk, he signed it without hesitation. On June 25, 1938, the Federal Food, Drug, and Cosmetic Act became law. This tragedy rewrote American safety. Subscribe now for more stories of the forgotten events that built our modern world. The moment passed quietly. No ceremony, no grand announcement. But in that unremarkable stroke of ink, America entered a new era. From that day forward, no drug could be legally sold without evidence of safety. Labels would be required to list ingredients clearly. Companies could no longer hide behind ignorance. The FDA gained authority to enter factories, demand testing, and halt production when danger was suspected. It was, in every sense, a law written in blood. In the years that followed, the ripples spread far beyond medicine. The same principle, that science must prove safety before release, began to influence food additives, cosmetics, and later, medical devices. Gradually, the American public learned to trust again. But it was a cautious trust born from memory. Every vial, every tablet, every prescription carried a shadow, a reminder of what happens when regulation sleeps. The Massengill Company survived the scandal, though never its shame. Lawsuits drained its finances, and its name became synonymous with negligence. In classrooms, chemistry professors began teaching the case as a lesson in ethics. New scientists were told, always test what you do not expect to harm. Assumption kills. Harold Watkins' story, once a footnote, became a cautionary tale whispered through laboratories for decades. Some said his ghost lingered in every safety manual. By the 1940s, the FDA's expanded powers began saving lives in ways few would ever see. Unsafe dyes were banned. False medical claims were stripped from advertisements. Factories were inspected, and hundreds of tainted products were stopped before they could ever reach the shelves. The system was not perfect, but it was a beginning, a framework born from tragedy. Every future advance in drug regulation, from clinical trials to post-market surveillance, traced its roots back to the raspberry-flavored poison of 1937. Historians would later write that the United States learned the cost of complacency that year. It learned that trust, once broken, demands proof. It learned that science without oversight is not progress, but peril. And in the quiet archives of the FDA, where letters from grieving families still rest, one line appears again and again in trembling handwriting. Please, make sure this never happens again. The elixir sulfanilamide disaster was more than a mistake. It was a mirror, showing the nation its own blind faith. From that reflection came the laws that define every medicine bottle we open today. Every label that lists ingredients, every warning about dosage, every test before approval, all trace back to those 100 lives lost in the autumn of 1937. Their suffering was not in vain. Out of it rose a system that would save millions. Even now, when we swallow a pill or measure syrup for a child, we are touched by that legacy. A century later, few remember the name Massengill. Fewer still know the face of Harold Watkins. But every patient, every doctor, every pharmacist who trusts that what's inside the bottle won't betray them, they owe that safety to the law born of their tragedy. And so, beneath the silence of graves long tended, the promise stands, never again.